Vanakkam, good morning. In this video, we are going to discuss about the physiological aspects of thyroid hormone. The first function of the thyroid hormone is that increases the basal metabolic rate in the all the body tissues except brain, retina, spleen, testis, lung. So increases the basal metabolic rate due to the increases the oxygen consumption in the tissues. So increases the basal metabolic rate in the tissue is called as the calorigenic action. In the hyperthyroidism, basal metabolic rate is 40 to 60% increased above the normal level. In the hypothyroidism, basal metabolic rate is decreased 20 to 40% below the normal basal metabolic rates. The second function of thyroid hormone is increases the protein synthesis in the cellular level. The increases the protein synthesis at the cellular level is due to the translation of the RNA that increases the production of the protein from the ribosome. The thyroxine also promote the transcription of the DNA to RNA. That is also helpful to the protein synthesis. It increases the activity of the mitochondrial level. So it increases the production of the ATP. It is used for the protein synthesis. It is also increases the production of the cellular enzymes, oxidative enzymes. This also helpful for the protein synthesis. So the protein metabolism, thyroxine increases the protein synthesis at the cellular level. Effect of thyroid hormone on carbohydrate metabolism. The thyroid hormone increases the glucose uptake from the gastrointestinal tract. It is also helpful to increases the glucose uptake by the cell. Thyroid hormone convert the glycogen into the glucose. It is also promote the gluconeogenesis. Effect of thyroid hormone on fat metabolism. It mobilizes the fat storage. The fat is converted to the free fatty acids. Increases the free fatty acid level in the blood. Same time, it is also decreases the cholesterol, triglyceride, phospholipid level. So in the hypothyroidism, cholesterol level, triglyceride level, phospholipid levels are increased in hypothyroidism. When the thyroid hormone is decreased, cholesterol level, triglyceride level, phospholipid level increases in the blood. So thyroid hormone decreases the fat storage and decreases the cholesterol, triglycerides and phospholipid level. Functions of the thyroid hormone on central nervous system. Thyroid hormone is very essential during early childhood period. So thyroid hormone is important for the myelination of the neuron. It produces the enzyme galactosyl transferase. It is important for the myelination of the neuron. It is very important for the brain development during the early childhood period and synaptic connections. It produces more synaptic connections, releases the more neurotransmitters. So thyroid hormone deficiency during the pregnancy period from the mother and early childhood period produces the hypothyroidism in children that produces a mental retardation. So growth of the brain is affected. So for irreversible, it produces a irreversible brain damage. So the thyroid hormone is important for the development of the central nervous system during the early childhood period. Thyroid functions on cardiovascular system. Thyroid hormone increases the number of the beta receptors in the cell, and it is also increases the beta receptor sensitivity in the ACA node. So it increases the heart rate. So not only increases the beta receptor number, it is also increases the beta receptor sensitivity in the ACA node. So it increases the heart rate. The thyroid hormone also increases the activity of the alpha myosin heavy chain present in the cardiac muscle, and G protein activity and calcium ATPase. This is helpful for the myocardial contractility. It increases the cardiac outputs. So thyroid hormone increases the systolic blood pressure due to it increases the heart rate and cardiac output. Thyroid hormone decreases the diastolic blood pressure due to the calorogenic actions. The vessel diameter is increases, so it produces the decreases the diastolic pressure, blood pressure, increases the systolic blood pressure. The important features of the hyperthyroidism is the sleeping tachycardia. Normally, pulse rate is decreased during the sleeping, but in the hyperthyroid state, sleeping pulse rate is increased. This is the important sign of the hyperthyroidism. Sleeping tachycardia is the one of the important feature of the hyperthyroidism. Thyroid hormone action on the respiratory system. Thyroid hormone increases the oxygen utilization in the tissue. So oxygen demand is increased. For the meet the oxygen demand, rate of respiration is increased, and it is also increases the minute ventilation. Minute ventilation is the how much amount of the air is transported to the alveoli per minute. That is also increased by the thyroid hormone. Thyroid hormone auction is similar to the sympathetic nervous system activation. So sympathetic nervous system activity is increased by the thyroid hormone. So it increases the number of the beta receptors, it increases the metabolism, it increases the body temperature, and stimulate the reticular activity system. Everything is similar to the sympathetic nervous system. It is also increases the thermogenin in the brown adipose tissue. So it is important for the calorogenic action. So thyroid hormone increases the release of thermogenin from the brown adipose tissue. So in the hyperthyroid state, the sympathetic nervous system is overactivated. So suppress the sympathetic nervous system. Commonly we give the drug beta blockers. Propranolol is prescribed for the hyperthyroid patients routinely. Thyroid hormone in gastrointestinal tract, it increases the gastrointestinal motility. Thyroid hormone is also increases the appetite and the absorption of the nutrients. The skeletal muscle, thyroid hormone increases the alpha myosin heavy chain activity and protein catabolism. So in the hypothyroid state, it produces the muscle cramps, weakness. The hyperthyroid state, it produces a myopathy. In the reproductive system, thyroid hormone is important for the follicular maturation, ovulation in the females. In the males, it is important for the spermatogenesis. In the Blood. Thyroid hormone stimulate the erythropoiesis. The renal system, thyroid hormone increases the glomerular filtration rate. Thyroid hormone is important for the sleep. Overactivity is decreases the sleep. Decrease secretion of the thyroid hormone produces increase the level of the sleep. So the thyroid hormone also regulate the sleep. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.